guest today is Dr. Tom Neville from UCLA Health, talking about granting end-of-life wishes for terminally ill patients in the Three Wishes program. You're connected with the Heart of Hospice. I'm Jerry Finter, here with Helen Bauer.
Whether you're a family caregiver or an end-of-life professional, we're here to enhance your hospice experience by connecting you with information you can use about end-of-life care.
Today's episode is sponsored by our friends at GrandPad. Do you have an older family member who's isolated, or do you feel disconnected from a senior loved one who lives at a distance? The folks at GrandPad have come up with the perfect solution, an easy-to-use device that connects older adults with family and friends using video chat, email, photo sharing, and more. Visit grandpad.net for details. It was actually a few months ago that I came across a news article about the Three Wishes program at UCLA Health, and I was so impressed by what they were doing that we just had to connect with them out there.
You sent me an email, and I think that's what it said. We just have to connect with this program, with these people running this program.
Yes. So Dr. Tom Neville was the one that we got in touch with, and she has been awesome. She's actually the lead on this program.
Yes, Dr. Neville joined the faculty in the UCLA Division of Pulmonary and Critical Care in 2012. She's both a clinician and a researcher. In 2017, she co-founded the Three Wishes program, and she is currently its medical director. She believes in practicing compassionate, patient-centered care in the ICU, and she knows that acts of kindness, and she refers to this several times, especially at the end of life, are essential to the healing process for all the stakeholders involved.
Yeah.
That includes patients, family caregivers, and the clinicians providing the care. Super important, very unique.
Yes. So that's one of the things that we talked with her about was how this has affected the staff. And I find this to be incredible. So yes, the staff's doing these wishes, these acts of kindness for the patients and the families. But they are the ones who oftentimes benefit from this. And she has seen the morale of the staff increase even during this time of the pandemic because they're doing these things for the patients' families. It's incredible to hear her stories.
And maybe even more benefit to the staff during the pandemic.
Oh, absolutely.
Okay, we're not going to tell her story. We're going to let her tell it because it's amazing. She's got some awesome stuff to tell. So here is our discussion with Dr. Tom Neville.
Dr. Neville, it is so good to have you on the Heart of Hospice podcast. Welcome.
Thank you. Thank you for having me.
Okay, Tom, we're going to start with an icebreaker question just to get the conversation rolling. Totally unrelated to our topics today. But so if in your wardrobe you could only have one color of clothing, what color would that be?
Well, that's so simple. Purple. Favorite color.
Oh, nice.
Ah, okay. The royal color.
I was going to say that's the color of royalty.
Yeah, very good.
You would be the queen. I like it.
Yep. This is the color for my wedding.
Oh, cool.
Oh, very nice. Very nice. Well, Dr. Neville, we are so glad that you're on the podcast with us. We found out about the Three Wishes program through, I think, a newsletter or actually a news posting. They were talking about the Three Wishes program, and it really got me interested in this because I think that our hospice and end-of-life care listeners would really find this to be helpful. Maybe even some of them be inspired to start. So tell us more about how the Three Wishes program got started there at UCLA Health.
Yeah. So the Three Wishes program is a palliative care initiative that actually started in Canada and not at UCLA. It was initiated by a physician by the name of Deborah Cook, who's a critical care doctor like myself. And she initiated in Hamilton, Ontario, and published a paper in the Annals of Internal Medicine. That's really how I found out about it. One of the palliative care physicians brought it to my attention that there was this initiative that one doctor had started in her ICU, and she was only doing it like once a month because and only the times when she was on service. And basically, the palliative care physician, Dr. Peter Fung, had asked if I would be interested in bringing it to UCLA. And as a critical care physician who has always been interested in palliative care and end-of-life care, I was very enthusiastic about it. And the premise of the initiative is really simple. It's, for healthcare workers to take the time out to ask patients and families what are their needs at the end of life, and to implement small wishes, what I really consider more like little acts of kindness for patients who are imminently dying in the hospital.
I love that idea. 3 wishes. So describe some of the things that you guys, that the team has done, the kind of requests that you have. What type of wishes are you granting?
Yeah, I can tell you it's not as cut and dry as you would think it is. I think a lot of times when patients and families are approached about a question like this, oh, what do you wish for? People look at me with a blank stare. People don't expect to be asked, like, what do they want? What do they need? And most people are really pleasantly surprised. But at the same time, many patients and families are not thinking about asking what the healthcare team can do for them non-medically at these times. So I can tell you, I think that a lot of the times we use this opportunity to get to know the patients a little bit more. So it won't be uncommon for me to, say, this is a program we have, but, why don't you just tell me a little bit more about your mother or about your father? Who is this person? What did they like to do when they were not ill? What are some of their favorite music? What is a favorite color or a favorite pastime? And I think in those instances, then a healthcare worker really can suggest wishes. So for instance, they can say, oh, how would you like it if we just played some their favorite music? Or even small comforting things. Can I bring your loved one a soft non-hospital blanket? Do they have a favorite food that they want? And I think a lot of the things that I have actually been very surprised that has been a huge part of the wishes has been keepsakes. So families have really shown me how important it is for them to leave the hospital with something that represents their loved one and be able to hold it tangibly. So we do a lot of fingerprints of the patient's fingerprints on keychains that they can take with them. We've done hand molds with a husband and wife holding hands for the final time. We've given patients' families locks of hair, things like that. And then I think so those are kind of the majority of the wishes we do are kind of small bedside things that we can do relatively easily and quickly. But I have to say there are also more of our extravagant wishes. And those take a little bit more time, a little bit more planning. So for instance, we had a patient who was unfortunately at the end of life, and her son had just got engaged. And she had always wanted to see his wedding and wanted him to get married, probably nagged him about it a lot, trying to get him to get married. And he finally got engaged when she was really sick. So the wish that our healthcare team did for them was that we were able to orchestrate a wedding so that she could be involved in it and present. And the wedding and this was actually during COVID time. So we had to get special permission, get an outdoor space, have people come in, had limited to just 3 or 4 people. So it's just going to be, the newlyweds and the person who's going to be orchestrating it and one other family member or something like that. So we're able to decorate it, make nice music, put out flowers, got them cake, and the nurses went above and beyond in terms of creating the wonderful environment. They used IV poles and created a little arch by covering it entirely with sheets and had a little tapestry on the top. And it was honestly one of the most beautiful and touching things I've ever seen. And I think that kind of experience really kind of brought the whole team together, not just the family, but the healthcare workers as well.
So that's one of the purposes of the Three Wishes program, it's not just to enhance the end-of-life experience for the patient and families, right? You're enhancing their end-of-life experience and how successful they feel that is, but it's also to enhance the experience for the clinicians.
Absolutely.
A lot of people grant wishes for, different organizations will do that, but it's not with the intent of enhancing the work experience for the clinicians. I think that's a really important, unique component of the Three Wishes. Tell us about that and what kind of influence that's had on your team.
Yeah. I mean, I would say that it was an unexpected experience for me, to be very honest, but a very wonderfully unexpected side effect, if you would say, that how rewarding it has been for healthcare workers. Like we published a paper on how it affected clinicians, and I did focus groups with the nurses who had implemented wishes for patients, and quotes came out like, Dr. Neville, this is why we do what we do. This has brought so much of our nursing spirit back, and it reminds me why I went into this field. Those quotes are really, really heartwarming. And I can tell you that whole experience of having that feeling that it's rewarding and elevates your vocation to another level was even further elevated by the pandemic. I can tell you that was unexpected for me as well, because I was so worried about the program disappearing altogether because of so many restrictions during the pandemic. But it was rather the opposite. So families couldn't be at the bedside. So the nurses really wanted to give them keepsakes and stuff, and we would mail it to the family. We would print out EKGs or, make fingerprint keychains and mail it that way. And the nurses would be telling me that, thank God that we have this program already in place so that we can do something for these families, because it is so the death is even so much more devastating when they can't be at the bedside. So in that essence, I feel like it has really taught me that, like, at the end of life, these really small acts of kindness really matter to an extraordinary degree.
So do you feel like it's improved the morale of your team of clinicians?
I do. And I could tell you one of the examples that one of the nurses did that really exemplified that. And he called it the ICU salon. So for instance, it was a patient who wanted, a patient's daughter told him that, her mom is always somebody who loved to be done up, like always liked to go to the spa and like get her hair done, and none of that was like obviously possible since she's been in the ICU. But he actually got the whole crew in the ICU together and asked what skills each of them had. So somebody was like did her nails, somebody washed her hair, somebody would cut her hair, somebody applied makeup. And basically he really described the whole experience as something that elevated the teamwork and brought us closer together. So I think it definitely has brought the morale up in our ICU.
That's pretty amazing when you think about it. You guys aren't, for lack of a better word, outsourcing this. When you say, we'd like to give you 3 wishes, end of life wishes, et cetera, you don't hand it off to somebody else. Your team that's actually already caring for the patient.
That's correct.
They're the ones providing or fulfilling those wishes. There's such an exponential effect there.
Yeah. And there's actually a terminology for, so there's specialist palliative care, right? Palliative care, there's only like a specialist would come in and do as a consult to take care of it. And what I consider 3 wishes is an extraordinary good example of primary palliative care. And what that means is the primary team, the people who are taking care of them, are most of the time eliciting and implementing these wishes. I do have a project manager, so she does come in and help if there is need from the nurses that calls her. But I would say the vast majority of the time, like 95% of the time, the wishes are purely done by the healthcare team that is taking care of the patient. And I think that makes a lot of sense for a project like this, because these are personal things that, are usually not medical needs, but things that like you would be I'm always pleasantly surprised how much nurses know about their patients just by the fact that they've been taking care of them day in, day out. And I mean, I've always prided myself in getting to know my patients really well, but nurses are at the bedside for 12 hours straight a shift. So they get to know the family and the patient really well and are able to listen and implement wishes much easier than I am.
It would also seem like that the patients there could be a positive effect on the patients as well, because it takes away some of the medicalization of their care, and makes it a little bit more personal, and takes it to a different level. It's not just clinical, it's now something that's personal, it's emotional as well, because you to find out more about this person, to know how to really fulfill the wishes that they're asking for, you need to get to know them. So you mentioned earlier on that you go in and you ask them questions, tell me more about, who you are. Tell me more about your mom or dad. What did they like? What did they do? What were their hobbies? And I think that really helps I would think it would help the patient to see or feel a little bit more connected with the team. Yeah. Also,
to feel seen and acknowledged as an individual, not just as a patient or a set of symptoms.
Right.
It's all about identity. Yeah.
Right. I have to say, in the ICU, so often our patients who are imminently dying are not in positions where they can communicate. But there are certainly cases where they have been. And my heart's always been warm when we're able to implement these wishes. Like, I can tell you there was one patient who was on the lung transplant list and was on a lot of oxygen and been in our ICU for a long time. And I can't remember clearly what the reason was, but he was eventually deemed no longer a candidate for a lung transplant, and therefore his care was directed towards comfort care. And we asked him what we could do for him. And he said his life is very much fulfilled, but he would love to have a final date night with his wife.
Nice.
And that was just so loving, like in terms of what the nurses were like, order special food, got a sheet out, made a tablecloth for one of our tables, set out little flowers and set up fake LED candles for them. They even logged into their Netflix account so they can watch a movie. It was just something that I think that was the perfect example of how that really made the healthcare team feel good about themselves as well.
During the pandemic, older adults who live alone have been more isolated than ever. My mom is the perfect example. She lives in a senior living community that went into lockdown, not only requiring her to stay in her apartment, but also restricting all of her family from visiting. GrandPad gave us the perfect solution to stay connected. Using the video chat option, we were able to see my mom and really know how she was. All of us in her private family network were able to share photos and messages about what we were doing, so she knew we were okay. My mom was really skeptical about using the device at first. She still has a flip phone and doesn't even own a computer. GrandPad comes with a 4G LTE cellular service already included, so there is no need for Wi-Fi. All of us in my mom's private network have shared photos and videos. We even sent her special videos on her 88th birthday, even though we couldn't celebrate in person. Mom has learned to use email, play bridge and solitaire, and listen to music she loves on her GrandPad. We are so grateful to the folks at GrandPad for allowing us to stay connected. You can purchase a GrandPad subscription for your loved one at grandpad.net. Now on to today's episode. So do you feel like participating in the Three Wishes program has changed the compassion fatigue or affected the compassion fatigue and the turnover that your staff has experienced?
Yeah. I hope so. I can tell you that I don't have hard data to support that, except for a preliminary study that I actually just did with my group, which was that we sent out surveys to family members of patients who have died in our ICU, and basically they rated higher emotional and spiritual support. So I think that, the nurses and healthcare workers are the ones that are responsible for that. So I certainly hope that has decreased the compassion fatigue, especially during these hard times.
Yeah. What a feeling of pride pride's not the right word for it, but yeah, what a feeling of pride to know that.
I was going to say, I think it is a good quote. Yeah. Right.
Yeah, maybe that is the right word. To know that, yeah, we hit all the marks. The symptom management was there. We had the pain managed. The breathing was comfortable.
Yeah.
Psychological support, spiritual support, patients clean as part of being comfortable. And in addition to all of that, look what we did.
Right.
Look what we did. Such a sense of accomplishment, and I think that would just be an amazing effect on a healthcare practitioner.
Yeah.
Yeah.
Tell us how this has affected you personally.
I think, I think a lot of people who go into critical care are like the movers and shakers of the earth, right? We want to fix something. We want to save lives. This is like, we're the intense people. We're called intensivists after all, right? And I think very early in my career, I kind of realized, we take care of the sickest patients, and the sickest patients are inevitably those who pass away, which makes a lot of sense, right? You don't want the well patients to pass away. These are the patients that are at the end of their health and long trials of treatment. So I very quickly learned that, end of life care was always going to be a big part of my practice. Our ICU mortality is 20%. So you can say that death is the most common diagnosis in our ICU. So I think end of life care is really, really important. And I teach my health staff that, and I think it's very important for us to realize that these are the moments that people are going to remember for the rest of their lives. You might not remember them. We take care of a lot of patients, but that mom, that daughter, that father is always going to remember the person that takes care of them at the very last moments of their loved one's life. And how the Three Wishes program has really affected me is that it has really taught me to realize that it's not only just those moments, but how much non-medical care is so important at these moments. And these are the moments that we should really no longer ask, what's the matter with the patient, but ask the question, what matters to the patient? And these are the moments where we really should stop saying, what else can we do medically, but think about what we can do non-medically, because those are limitless. And I think that's the main thing that has affected me. I have realized that obviously I've gone through so much training to become the doctor I am now, but that's the very end of a lot of people's lives. When the medicine has reached its limits, is really the non-medical care that is going to matter.
And, for those of us working in hospice and the end-of-life industry, we understand exactly what you're saying. Mm-hmm. That, here at the end of life, there's only so much that we can do from a medical perspective. Right. We can treat the symptoms. We can manage the symptoms the best we can. But what the patient and the family really need is the non-medical care, that hand-holding, the being there. And like you're doing with UCLA Health and the Three Wishes program, it's really getting away from the medical and looking at the non-medical part of it. And you used a word that I think really hits us all, and that is the memories. What are the memories that these people are going to take away from this? And if we can somehow give them a positive memory, something that's really going to be special and a positive thing and not a negative one, then certainly we have done an incredible service for them if we can do that. So I love that the Three Wishes is doing that. So what do you think is the most outrageous request that you've had?
I've had outrageous requests that we really cannot accomplish. So, for instance, which is one that resonated with me? It was a older woman and was able to tell us her own wishes, and it was, I guess it was maybe 3 years ago, and she said, "Can we make Trump not president anymore.
So she wanted you to change out the president of the United States. That is a pretty stiff request.
It is. And we're like, oh, I wish, but I couldn't. And then there were some wishes that were like just too costly. So for instance, which is unfortunate. But like one of the wishes was a family really wanted their father's body be flown back to their home country. That would be in the upwards of like $15,000. And that is something that is really not within the budget, nor really within the premise of what we were. We're really about like making small wishes come true at the bedside and little things, and not really kind of grand gestures like that. I think those kind of the two that stuck out in my mind.
So I was looking at your website and I saw some of the smaller things. So nice. I saw the table that they had made up for the date night. I thought that was very cool. But you also do something called word clouds.
Mm-hmm.
And I've seen those pictures before, those graphics, but I didn't know it was called a word cloud. Mm-hmm. Tell us about that and how your staff goes about creating and crafting something like that for a patient and a family.
I actually really love the word cloud, and I actually love it mainly because the activity aspect. So it's not so much it is, but it's also beyond the product that we give them.
Right.
So basically what I tell my staff and what we do is that we give a family member a blank piece of paper. I would really love to create a word cloud that kind of commemorates who your loved one is. And we would create it for you and frame it and give it to you. But we need some words from you to describe who this patient is. So, as people who work in hospice, you guys have probably experienced like in the final moments, a lot of times it's just waiting at the bedside for patients to pass. So these moments are really, really hard for family members. And this activity kind of takes away some of that difficulty in that I ask them to not focus on a dying patient, but let's focus on who this person is. Write on these pieces of paper, this is somebody who likes to hike, somebody who loves rainbows. This is mom. She is a grouchy, mean woman, or she's a very pleasant, funny woman, and write all the words that you can think of. And what I have also loved is that they have, some families have posted on social media or send out a message, an email to all their friends and family, can you come up with words? And everybody comes up with like 10 words or something. I remember there was a granddaughter who did post on social media, and her grandmother actually was still lucid at the time. And she would tell her grandmother, like, Grandma, somebody just told me, just posted on, reply back to my question with this unique story that like I had no idea like happened in your life. And it was an event that I could chuckle about and talk about. And she said that like, this would never have happened if not for this word cloud activity. So I think it's a really great activity for the family. And then in the end, we just, whether it's going to be a nurse or my project manager or even myself, we put it in a free online program and create a collection of words and frame it into a nice picture and present it to the family members. And in the beginning of the project, I had invited a lot of family members back to tell me about what the effect that the Three Wishes program had on them and what they did with the stuff. And the word cloud always came up like this, we have now blown it up to poster size and display it in our room. I have used it to give it to my grandson when he turned 18. I have, made it into t-shirts we all wear at family gatherings now. So it's kind of a gift that keeps on giving almost. Like it's not only an actual thing, but also an activity and then an ongoing memory.
I love that. I think out of all the wishes that you've described, I think that's probably my favorite. I absolutely love that.
I think one of the things that I hope they'll also turn out, which which maybe you guys would be even use it more, is that as somebody had said, maybe it can be used as more of a legacy product too. So for the dying patient, for instance, if they want to make something for a son or a granddaughter or something, or they're going to miss their graduation, they can have an opportunity to leave their words behind. We haven't done that, but I think that's a great avenue as well for the word cloud.
I think giving people a chance to have something to do, when they're waiting. Waiting is so hard. Waiting is so hard. And
it really is.
You get bogged down in the grief and the exhaustion and the fear and the anticipation of the loss. And that's all you can see. But if somebody said, tell me who he is, if you could write down 10 words that describe him, that's life review. Yeah, right? That's what our chaplains and our social workers do anyway.
Exactly.
So what a wonderfully creative way to not just have a conversation, but to have it come into fruition in something that's tangible. And then I love the T-shirt idea. I absolutely love that. Yeah, I think that's just an awesome concept. It's funny. So what if you just told the family, 6 family members, each of you just come up with 10 words? Such a small thing.
Right.
And it makes me think of the hospital blanket versus a home blanket. And you would think, oh, that's no big deal. I'm sorry. Anybody who's been in the hospital and had a hospital blanket would understand that a blanket from your house means a lot.
Yeah.
Yeah.
That reminds me of a story that I would really love to tell you about our first 3 Wishes patient. So we had just obtained IRB approval to start the program, and I happened to be the attending on service that day. I had a patient on service who was it was really unfortunate. He was only in his 30s, but clearly dying probably for weeks before I even came on. He was maxed out on every medication, maxed out on the ventilator, was never waking up because of disseminated varicella. And I talked to his wife, and one of the things I learned was that she was really horrified of the idea of him dying within the 4 walls of the ICU. And they had just got married. They loved hiking. They loved sunsets. They had moved to Santa Monica. Like, the outdoors was really important to them. And so what I had suggested to her was that we can take her and him outside to our outdoor patio at sunset and provide end-of-life care outside. This was actually kind of a scary experience for all of us because we had never done it before. As you can imagine, bringing an ICU bed with a ventilator, with IV poles and everything's not trivial in an area that's not used for patient care. And we had to make sure there was certainly oxygen, suction, pain medications, everything that was set up that could be set up outside. But what was really sweet about that moment was when we rolled out the bed outside, she crawled into bed with him, and I handed her a non-hospital blanket, and she snuggled up next to her husband. And I disconnected him from the ventilator, and he died as the sun set. And she really laid in his arms with a non-hospital blanket. And I can tell you that whole experience brought my whole team, myself included, to tears, and it was so powerful. And even more powerful was when I invited her back and I asked her, I don't know if you remember, I gave you this non-hospital blanket. And she told me that was the only way she sleeps at night, was with that blanket. Because that was the last thing he touched. And it was a really soft, non-hospital and warm blanket that she felt like she was touching him. And that really helped her get through the few days that were coming.
Oh my goodness.
If that was the only wish that you ever granted, it would be worth it. But
wouldn't that be
really
enough?
Was.
And you've been able to do that. So how many wishes has the 3 Wishes program at UCLA Health granted?
That's a good question. I wish. So we have now achieved 3 Wishes for over 1,100 patients. And even though we call it a 3 Wishes program, it could be 1 wish. It could be we've done as few as 1 wish, as many as 9 wishes. So it's quite a range, but it's usually average about 3 to 4 wishes per patient. So I'm going to say probably about 3,000-4,000 wishes.
Wow. What
awesome.
dedication from you and your team.
It's a lot of dedication from the people around me. And I have to say that I'm very, very lucky. I feel very lucky to be surrounded by a lot of like-minded healthcare workers who really feel like this is a worthy cause.
That's awesome. Have you heard of other hospital systems or other healthcare entities who have started something like this?
Yeah. So, I mean, during this whole entire period, just like you guys have found out of me, like I've received inquiries from other hospitals too, like this is something that we would love to start. I would say that since this program did start in Canada, I would say there's like, I think 3 or 4 hospitals up there that has officially done it. In the United States, there's probably more like a handful. And I would say none of them are probably as, I don't know what I want to say, robust or like as large or as commonly performed as it is at UCLA, but I would say probably a handful have. But beyond that, I would say over 20 hospitals have contacted me with interest. And what I have done and what I hope to continue to do is to make it easier for programs to kind of emulate our old program. I'm trying to come up not just the website that you guys have seen, but a Three Wishes toolkit kind of website for how would hospitals started kind of thing. Like, this is what I would advise is start a meeting, get stakeholders, get established champions. And this is what I would advise you to have in your good old inventory at the bedside that would make life easier and easier to implement in terms of word cloud materials or blankets or fingerprints and materials. So it is my hope that with these tools that we will be able to expand the program further throughout the nation.
That's wonderful. Sort of mentoring for other hospital systems that want to do the same thing. I think that would be an amazing ripple effect.
I hope so.
Yeah.
I hope so. Yeah.
I love that.
We are so glad that you took the initiative and had the courage to start this there at UCLA Health. And we're grateful to you for sharing this information with us today. And we really hope that some of our listeners will be inspired to maybe start some of their own. And we'll give your UCLA Health website information to them. There'll actually be a link in our show notes for this episode so that they can click on that and go and take a look at what you're doing and how you do some of that, and maybe even get in touch with you at some point if they have more questions and really want to find out how to get something like this started. Dr. Neville, thank you for taking the time out of your day to talk with us.
That's so great.
So wonderful. Thank you so much.
Of course.
Okay. Did you cry? I think I cried.
I'm not crying. You're crying.
All right.
We both did. And, that is the hallmark sign of a good interview.
It's
where
true.
either the guest and or some of the hosts of the podcast get tearful. Very moving. Very moving. Their first wish, Jerry.
First one, yep.
A patient on a ventilator. His family wanted him to be outside. He was a nature lover. Had his wife there. And she was able to get in the bed, snuggle with him, cuddle him. They were covered with a non-hospital blanket so they could be together, and he could be disconnected from the ventilator and die there under the sky.
Yeah, at sunset.
Beautiful. I mean, it almost sounds like something out of a Hallmark movie. However, those of us who work in end-of-life care with profoundly ill patients will understand the value of something like that, to remove the clinicalization and acknowledge the humanity and the personhood of this man. He wasn't a patient. Let's call him what he was. He was a man.
Right.
Who loved to be outdoors.
Right. So here's what we say often, but we cannot say it often enough, and that is death is not a medical event. It is a communal event.
A communal event, a spiritual, psychosocial event.
Yes. It's a sacred event, if you will, but it's not a medical event. We've medicalized it, but that doesn't take away from the fact that it is not a medical event.
And thank you to Dr. Neville and the team at UCLA Health that are granting these wishes. You guys are amazing.
Yeah. I love the way that this personalizes the experience for the patient and the family.
It doesn't have to be, Make-A-Wish or whatever. It doesn't have to be a trip to Disneyland.
No.
And people who are so profoundly ill and so close to the end of life, those small things are huge.
Right.
Huge. So if you are a hospice clinician, you belong to a hospice team, you're an owner, you're an administrator, a physician, whatever your discipline is, you're an end-of-life doula, listen to your patients. Ask them. That communication is so important. Listen to what they're saying. What are the small acts of kindness that you wouldn't even have to consider them wishes? A blanket that's not hospital issue, that doesn't sound like a wish to me. That sounds like something everybody should get, quite frankly.
Right.
But a small act of kindness that has such incredible meaning at such a crucial time. I would tell you that I have been at the bedside for tons of patients. I don't remember all of them. And I would say that I would want to remember all of them. There are certain deaths that stick out to me, certain families that I grew to know and to care about very much. But I don't remember all the people. But I guarantee you that every patient that's participated in the Three Wishes program, every family that's participated, they remember those things.
Oh, definitely.
They remember those acts of kindness. So if you are one of those professionals that is granting those wishes, that's providing those acts of kindness, know that that will be remembered. That will always be remembered. You and your act of kindness will never be forgotten.
These moments become very, very precious to the family.
Yeah, it's a legacy.
It is. It is. And so she talked about how that first wish with the man outside at sunset who died, and they'd given the wife the non-hospital blanket.
Right.
She treasured that.
She kept it.
She kept it. And used it. She slept with it.
Yes, it made her feel physically connected to him.
Right.
So important.
It
Man,
is.
what meaning. It's just a blanket, but incredible meaning.
We have the opportunity to create those incredible moments for people. Let's not waste the opportunity.
You have the opportunity to create that kind of meaning for the people you care for, not your patients and not their caregivers, but for the people and their loved ones.
Right.
That you care for.
Thanks for listening to The Heart of Hospice. I'm Jerry Finter here with Helen Bauer. Because we know your hospice journey is 24/7, you can always find us at theheartofhospice.com. Subscribe to the podcast wherever you're listening and leave a rating or a review on Apple Podcasts.
To connect with us, just send an email to host@theheartofhospice.com. You can also find us on social media. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.